Okay, let's just dive right into this. This explainer is actually a bit off topic for us. Usually, we're unpacking economics or, I don't know, historical events. But today we are zeroing in on the incredibly exhausted, very real, and just completely overwhelming reality of being a new parent. Specifically, we're going to look at how the entire world approaches where and how babies sleep.
And honestly, it all started with this text message from a new mom. She wrote, "New parents are going to co-sleep out of desperation at some point, and unplanned co-sleeping is so much more dangerous. I feel it's really unfortunate that there's so few resources on harm reduction in co-sleeping environments." That message really hit home, right? Because it highlights this massive gap between ideal medical guidelines and what's actually happening out there in the middle of the night.
But hey, before we go literally one step further, I need to make something absolutely crystal clear. We are not pediatricians, and many American pediatricians recommend strictly against co-sleeping. Our goal today isn't to endorse any specific viewpoint or give you medical advice. Not at all. We're just summarizing the medical advice from around the world, looking at different cultural practices and presenting the harm reduction data so we can all understand the full picture.
All right, Section 1, Defining Infant Sleep Terms.
So first things first, let's define co-sleeping. It's really important to understand that co-sleeping is actually a massive umbrella term. It simply refers to an adult and a baby sleeping together on any surface. So sure, that could mean a bed, but it also includes falling asleep in a rocking chair, on a recliner, or just crashing on the sofa. Now, the absolute most critical distinction we need to make here is the difference between room sharing and bed sharing. Room sharing, which is having the baby's crib or bassinet in the exact same room as the parents, is globally recommended for the first 6 months. The data shows it actively lowers the risk of SIDS. But bed sharing, that means sharing the exact same sleeping surface like the adult bed. And that is where the medical advice gets highly contentious.
Moving on to Section 2, Practices Around the World.
It's pretty fascinating how cultural norms totally reshaped what we consider quote-unquote normal infant sleep. Take the US, for example. The culture here really pushes for early independence and self-reliance, right? So solitary sleep in cribs is the standard. But look at Japan. Over there, the emphasis is all about harmony and interdependence. Japanese infants and kids typically sleep right next to their mothers on futons, sometimes until their early teens. And then we look at Mayan mothers in Guatemala. Anthropological studies show that they view the American practice of putting a baby alone in a room with absolute shock. They actually pity us and sometimes even consider it tantamount to child neglect. Wild, right?
And hey, these aren't just isolated, quirky examples. In fact, early anthropological studies suggest that in roughly 90% of cultures worldwide, infants sleep with their parents instead of in solitary cradles or cribs. So from a broad historical perspective, sharing a sleep space is actually the human norm.
But okay, let's bring it back home for a second. What happens when we look at the actual medical professionals practicing right here in a country that officially recommends against bed sharing? Well, a recent study published in the journal PLOS One looked at exactly this, surveying breastfeeding physicians here in the United States.
Check this out. A nationwide survey found that 68% of the breastfeeding physicians they talked to reported some history of bed sharing themselves. And get this, over 70% of these respondents were actually in specialties caring for pregnant people or infants. They did it primarily just to facilitate breastfeeding and honestly manage sheer exhaustion. It really highlights this profound cognitive dissonance between the official rules they have to tell their patients and the totally exhausted reality they face in their own bedrooms at 3 a.m.
All right, Section 3, the danger of unplanned sleep.
Now the research clearly highlights an incredibly important distinction here. As the source material notes, unplanned bed sharing is associated with a twofold increased risk of SIDS, whereas routine bed sharing without hazards does not appear to be associated with an increased risk. So what does this actually mean? It means the true danger heavily spikes during those unplanned events.
And this brings us to a really crucial unintended consequence. In a desperate attempt to follow the rules and just totally avoid bringing the baby into the adult bed, an exhausted parent will sit up on a sofa or maybe a recliner to feed or soothe their baby. And then they inevitably crash. And falling asleep with an infant on a sofa, that is incredibly dangerous because of the massive risks of suffocation and entrapment.
So let's clearly lay out what those hazards are, because the data universally agrees that certain circumstances severely increase the risk of a tragedy. We're talking about sleeping on sofas or chairs with a baby, having any soft bedding or pillows near the infant, bed sharing if the parent is impaired by alcohol or drugs, bed sharing if a parent smokes, or doing it with a baby who was born preterm or with a low birth weight. These are the big red flags.
Just take a look at this official graphic from UNICEF in the UK. It powerfully emphasizes exactly what we just covered. It points out that if no baby co-slept in those specific, hazardous situations we just talked about, like crashing on a sofa or with a parent who has been drinking or smoking, we could potentially reduce co-sleeping SIDS deaths by nearly 90%. I mean, wow, 90%? That is an absolutely staggering statistic when we're talking about harm reduction.
Which leads us perfectly into Section 4, harm reduction and safety.
So let's talk about what parents can do to do it more safely. Recognizing that totally depleted parents are absolutely going to accidentally fall asleep, concepts like the Safe Sleep 7 come into play. These are guidelines developed by organizations like La Leche League. And let's be clear, they aren't there to push parents into bed sharing over using a crib. Nope. They exist to provide a vital safety net for the parent who finds themselves accidentally dozing off out of sheer exhaustion, just making sure that if it does happen, the environment is as safe as it can possibly be.
If you do end up bed sharing, the harm reduction source material advises some very strict environmental rules. First, you gotta have a firm mattress, so absolutely no waterbeds or those squishy soft toppers. There should be 0 loose blankets, heavy dunas, or pillows anywhere near the baby's face. You also have to make sure there are no gaps between the bed and the wall where a baby could get stuck. The baby always has to be placed on their back. And for sure, absolutely no smoking and no alcohol or drug use that would impair your normal waking responses.
It's also super vital to mention the complex relationship this all has with breastfeeding. Researchers actually link bed sharing with a significantly longer duration of breastfeeding. Now, why does that matter? Well, because breastfeeding itself is a known significant biological factor that actively protects babies against SIDS. It's this fascinating, totally interconnected web of risks and protective factors.
Okay, final part, Section 5, the final medical advice.
Now, returning from all that global data back to the United States, despite that 90% global practice we talked about, and despite all the harm reduction data, the American Academy of Pediatrics maintains a very strict, unambiguous policy. Their 2022 update states super clearly, "We are unable to recommend bed sharing under any circumstance." They specifically cite the risks of suffocation and SIDS, especially for infants under 4 months old.
So ultimately, our takeaway from summarizing all this source material is this. Remember, many American pediatricians recommend against this practice, but if you are going to do it, practice it safely. If that sheer 3 a.m. desperation hits, you have to eliminate the hazards. Stay off the sofa, clear away the bedding, stay completely sober, and just practice it as safely as humanly possible. And all of this leaves us with a really profound, honestly pretty difficult question to ponder. How can society better support new parents so they aren't forced to choose between strict idealized medical guidelines and their own desperate, totally biological need for sleep? It's a reality millions of people face every single night, and it's a conversation that clearly needs to keep happening. Anyway, thanks so much for joining me on this deep dive, and I'll catch you in the next explainer.